Hi, this is Steve Adler. Got a minute? We're going to go through some the virus numbers that we can look at tonight. We'll touch real briefly on the public safety meeting today. Good discussion about homelessness. And we'll talk about voting. Not very long tonight, but let's go ahead and get started. We're going to take a look at the first dashboard. Significant. We start with hospitalizations always, 20 new admissions. That takes the 7-day moving average up to 18. That's still below the mark. We were trying to get below 10. We got down to 12 3 times. Tried to push it down below 10, couldn't get there. Our number increasing is what we're seeing happening in states across the country. Also, what we see happening in cities in Texas. Austin's actually doing better than most of the other cities. Some of the cities in Texas are just screaming right now with their numbers, like El Paso and Lubbock and Amarillo. 18 is the 7-day moving average we're at right now. You know when the last time we were as high as 18 in Austin? September 9th. September 9th. Well over a month ago. We really need people to stay focused on masking. And as we open more things, as we open more restaurants, as we open the schools, we actually have to do a better job of masking because we're allowing additional contacts and additional interactions. So in order to even preserve the status quo, we have to be doing a better job of the social distancing and of the wearing of the masks. I just wish it wasn't a political issue. Because it's all about the science. It's probably the single most important thing that we can be doing. We need to try to do it. The doctors tell us that the admissions that we're seeing are the result, really, more than anything else, social gatherings. People that are getting together with friends in the evening. People are getting together more and more with more and more people in the evenings. You're with somebody that you put your defenses down, you don't wear your masks, and then suddenly there's an infection that gets passed along the family. So even if you know the other person, if they're not in your household group, you got to be wearing masks. That's a number that's concerning. You can see the chart in the middle, how admissions seem to be moving upwards in the right-hand corner. We'll take a look at the UT dashboard in just a second. Number of new cases today is 97. That is just above the 7-day moving average of 93. See the teal numbers in the middle, 97, 36, and 23. We're going to talk about those in just a second. Let's go to the next dashboard. Those are the numbers of the 7-day moving averages for hospitalizations, but we're going to go ahead and look and see how many people we actually have in the hospitals, in the ICUs, and on ventilators. Tonight, 104 people in the hospital. A 7-day moving average is 97, but we have 104 in the hospital. So again, that 7-day moving average is moving up. ICUs tonight in the ICUs, 43. The 7-day moving average is 36. So we're significantly above the 7-day moving average. Remember, when our system gets taxed, it's going to be with ICUs. That's the first place that we start having challenges. So we're going to have to watch that number, make sure that we don't. Remember the ICU number, if it takes us a week or several days to see an infection turn into a case, and it takes us a week to 2 weeks to have an infection turn into a hospitalization, then we're talking about 2 to 3 weeks before we have an ICU. So if that number of ICUs starts going up too much and we decide we're going to do something to get that number to stop, it's going to continue going up for another 2 to 3 weeks before anything we do is going to have any kind of impact. That's why we have the triggers we have. That takes into account the fact that if we did something, the numbers are going to continue to rise, and that's because it takes 2 to 3 weeks before we see a change in behavior actually start impacting the hospitalizations and the ICU numbers. Number of cases up at 31,053. Number of people that have passed away, 446. That's an increase of 1 over yesterday. Always important to touch base on that number because this is about real people. But let's take a look at the numbers that Dr. Escott's looking at. Let's take a look at the UT dashboard. Dr. Escott, I was on the call with him today, said that the numbers were concerning. Here's the UT dashboard. We start with the R factor. That's in the upper left-hand corner. Remember, above 1, the virus is spreading. Below 1, it's dying. We had a long period of time where we were below 1. We're now at 1.28. Which means that the virus is increasing in our city. The probability is growing, almost 90%. The 14-day change in the number of infections, we have 32% more. But look at the chart. The green dots are actual numbers. The green line is the smoothed out 7-day average. And then as you look to the right, that gray spaghetti show you all the different scenarios. Each scenario has the same statistical chance of happening, but the mean of all of those is the dark green line, and you can see that it's going up. That is what the model is predicting at this point, and that's a concern. If you look over to the left, remember hospitalization, hospital admissions is what we're looking at. You know, if we go above 40, then we begin to start taking a look at whether or not we should go in the orange zone. We're in yellow now. We were trying to get into the blue, but we're headed in the wrong way. Yellow zone, do we go into orange? Somewhere between 40 and 70 admissions is what Dr. Escott said we should be looking at to go into the orange zone. Whether it's 40 or 70 depends on how quickly the numbers are rising to that point. But you can look off to the right and you can see where 40 intersects with that green line. We begin to hit 40 just probably a week or two into November if this model holds. That's the concern. We want to be doing everything we can to hold on to kids being able to go back to school. So vigilance, masking, distancing, we've just got to do that as a community if we want to hold on to the things we're able to try now. We had a presentation today about the challenge of homelessness at the Public Safety Committee at the Council. I just want to share quickly some slides we saw. Progress on homelessness, 29, we lost it, there it is. This is setting up the violet bag kiosk locations. This is where we're helping to police and gather the trash, etc. On campsites that you see where you have people collecting at the underpasses. We have 20 new violet bag kiosk locations opened in the city. 22 of those have opened here in 2020. That's because we need to spend a lot more time and focus on the visual appearance, as well as it just makes for a safer, better location for people. Let's look at the next chart. 37 clients are storing materials now at a storage facility in 2020. This is they have a private space that they can access, keep their stuff secure. If you're experiencing homelessness, one of the chief issues you have is that you lose your stuff. You can lose your birth certificate, and then it takes you months to be able to get one back. It's just hard. But the more we can help people kind of get control of their lives, the better chance we have of being able to get them off the street. Being able to take care of your stuff is a significant part of that. Let's go to the next chart. 530 people have accessed temporary emergency shelter at the Pro Lodges. A lot of those are the motels that we're purchasing or leasing. This is what we did in order to be able to make sure that we were able to control outbreaks of COVID within the community of people experiencing homelessness. We did that really well and aggressively. There are a lot of cities around the country that are having spikes in the communities experiencing homelessness, and then it spreads to other populations outside of that. 530 people experiencing homelessness were able to find shelter and be protected, or to isolate given immediate risk of virus in and around them, or maybe themselves. Let's go to the next slide. So far this year, we've been able to help 1,387 people move into housing in 2020. You know, there's a lot of people that fall in and out of experiencing homelessness. Sometimes we think about it as a static number, if only that were true. But there are people that move into homelessness, and certainly during COVID, a lot of people out of work. There are, the risk of more people moving in that way. When we take away the eviction protection, then we're going to have a lot more people potentially on the streets. We're working on that challenge right now. But 1,387 people have been moved into housing and out of homelessness in 2020. And Janine, I think that may have been the last chart that we had. Just want to close by talking about voting. There's momentum to vote. Everybody should be making a plan to vote. We're in the last 2 weeks of voting right now, 15 days left. Don't think about election day as the voting day. Think about it as the last possible day to vote. Great if everybody was an October voter to get in and vote early. Lots of places to go. Look at that site that you see there, votetravis.com. You can go there and it'll tell you. You can click on another link. It'll tell you how long the wait is at the different locations. But everybody should be voting. So far in Texas, over 4 million people have already voted. 4 million people. November 3rd is coming up, but 4 million people already voted. That means that Texas is leading the nation in the number of people that have voted among states. California, about 3 million people have voted. Florida, about 2.5 million people. But in Texas, 4 million people. That means that Texas is responsible for about 14% of all of the votes that have been cast thus far in the entire country. 14%. It is great how many people are voting in Texas. 4 million people, what is that? 4 million people is 45% of all the Texans that voted in the 2016 election. There are about 9 million people that voted in the 2016 election. I think we're going to pass that number because I don't think we have 45% of the people that are going to vote in this election vote. But already we've had more people. We've had about 45% of the total people that voted in 2016 have already voted. Let's keep up the momentum. Let's make sure that we continue to vote. Make sure that when you vote, not only do you vote for the president at the top of the ballot, but you work your way all the way down through the ballot. Vote for the United States Senate, vote for Congress, vote for the Texas House of Representatives, vote for all the judges, vote for city council members, and vote on Proposition A and B. Work your way all the way through the ballot. With that, wish you all a good evening. Take care of yourselves and be safe. Good night.